we designed a randomized controlled trial that included patients with advanced cancer, so patients with metastatic solid tumor who had a prognosis of 1 year or less. And patients were randomized to, these are patients that were admitted to the hospital with advanced cancer, and they were randomized to getting the video intervention of a CPR video, which was a 3-minute video, plus standard oncology care compared to patients receiving standard oncology care alone. And standard oncology care at our institution, as well as the other institution that the study was conducted at Mass General and Stanford University. And the standard of care is a physician talking to the patient at the time of admission about their CPR options and what they would prefer. And so in addition to that standard, we also provided a video to patients randomized to the video intervention. Now, the video is developed with input from a lot of experts from intensive care, oncology, palliative care, medical ethicists, and the idea, and patients and families as well. And the idea was to really provide an unbiased, objective view of what CPR is that is not too emotive, but also providing people with realistic expectations of the likely outcome. And so what we found in our study, that patients that are randomized to the video intervention were less likely to prefer CPR for themselves, but more importantly, they were more informed about their choices and decisions. And specifically, we assessed patients' knowledge about CPR using 4 true and false and 1 multiple choice question. And what we found, that patients after watching the video were much more informed about their about CPR, about those medical interventions, compared to the control arm. Moreover, we noticed that patients who were randomized to the video intervention were very comfortable watching the video. They found it very helpful, and 94% of them would recommend it to others facing similar decisions. And that really tells us that patients are not being scared by this video. They are feeling comfortable watching such and utilizing such an instrument to help them with decision making. And recommending it to others is a strong statement about how they feel, how the video was helpful to them.